Hey, I just made like a really long video and I got disconnected, which is rad. But I'm Brennan and it is July 17th. And I wanted to talk a little bit about trans healthcare, specifically my experiences with trans healthcare and what trans people mean when we talk about trans healthcare. I think a lot of cis people, and with the increasing of trans visibility and of like what we're asking for, which is like equal healthcare and adequate healthcare for our needs. People tend to think that that means like just like only concerns surgery, which is like an issue in and of itself because like I've mentioned in other videos, a lot of trans people don't get surgery for a lot of reasons, and that's fine. That's not any of your business. So like when trans people talk about trans healthcare, we're not talking about like just giving away surgeries to people at the expense of your tax dollars. We're talking about healthcare that is inclusive and is actually like benefits us and makes us feel comfortable. A lot of trans people don't access medical care for a lot of reasons. Financial issues are a big one. There are like, when you're trans, it is hard to keep and it's hard to get and keep jobs. That's a reality. If you don't believe me, you can like go talk to other trans people or watch other people's videos about issues with employment. It is a very real reality. It is still legal in the United States to fire people for their gender identity. So yeah, that's a fact. And like also with insurance, a lot of trans people can't get great insurance. A lot of insurance actually have exclusionary clauses that says we do not cover transgender care, and it's like what specifically does that mean when you say you don't cover transgender care? To the cis mind, that means you can't get your surgery covered. But what about hormones? What about me being able to get a pap smear once my gender markers have changed on my ID? Like even though I still have like a uterus, and it's like it's a slippery slope. And yeah, there's just a lot of misunderstanding about what trans healthcare really means. Some of my own issues with healthcare and with accessing care, a big one is being treated beyond the gender binary. Having to walk into a doctor's office and fill out an intake form where it's like, select M or F, that immediately is isolating to me because it's like I don't fit in there. There's more than two options, like, and when I'm reaching a point in my physical transition where it's like, yeah, I was assigned female at birth, yeah, I have these, like, female body parts, but, like, I live life as a man, I'm starting to visibly resemble a man, like, at a certain point in the future, like, I'm probably going to have my gender markers changed, and it's like, which one do I pick? Like, because like I don't fit either of those physically, mentally, anything. So that's immediately really isolating. And then other things like, for women only, when was your last period? It's like, am I supposed to answer that? Like, it's very confusing to me. And I just think there needs to be room in healthcare that's inclusive to trans people. There are ways to talk about the body that there are ways to talk about the body without gendering the body. I did work in public health for a while. I was sort of like in a patient advocate, STD testing capacity. And I would witness a lot of, healthcare professionals speak about bodies in ways that were very, like, pigeonholing and, like, probably traumatizing for patients, and it makes trans people not want to come back to your healthcare facility. Like, just like the idea in medical circles, medical communities, medical professions that there are like male and female clearly split between like XX vagina lives as a woman, like XY penis lives as a man. Like that needs to go away because that's not reality. It doesn't reflect reality. And when you're a profession that's dealing with the real health of real people, like you should be dealing with reality, not with policed binaries that don't reflect a lot of people's actual existence. Another like big issue is it's like getting hormones. I just want to talk about my experience with getting hormones. Testosterone is a controlled substance, and in order for mine to be covered by insurance, I had to like prove like why I was going on it because I have like an F gender marker. But if I were being prescribed testosterone as a cis man because I was having trouble relating to my body sexually because I'm slightly impotent, which is kind of what I'm dealing with as a trans man, but okay. I could go on it and have it covered by insurance, no problem. You know, if you're a woman, a cis woman, which means, you know, you were born, assigned a woman at birth, lived your whole life being comfortable with being a woman, and you go through menopause and you want to retain your, you know, femininity that's starting to go away, you're almost bullied into taking HRT, whereas a trans woman wouldn't be able to get that to be covered by insurance, might even have trouble getting it prescribed. And that's a big deal. Like, when you have, like, medical procedures, like hormonal medical procedures that you're, like, extending and almost forcing upon and, like, over-prescribing to one pop, like, demographic, but you're, like, telling another that they can't have it because of X, Y, and Z and forcing them to prove why they need it. Like, that's discrimination. Like, that is straight-up discrimination. It's a problem. It needs to stop. Like, I should be able to get on hormones as easily as, like, anybody else getting prescribed the same hormones. Like, what my genitals are doing, I have nothing to do with that. So, yeah, like, informed consent should mean that, like, it should be covered by my insurance, which is just really frustrating. Like, if, you know, if you feel like hormones shouldn't be covered by insurance, hormones shouldn't be covered by insurance, period, then, if that's, like, how you really want to talk about it. Like, it's, you know, transgender people aren't doing this for cosmetic reasons. It's mental health, it's, like, spiritual health, it's physical health. Like, it's not, I don't know. Clearly I have, like, a lot of issues there that I'm not really ready to articulate. Also something that, like, I run into, like, maybe, like, getting around to, like, mental health, because I did mention it just then. As somebody who is, like, chronically mentally ill, I have depression, really serious depression. I also have borderline personality disorder. It's been really hard for me to find mental health care that is trans affirming and doesn't lump my trans identity in with, like, me being crazy. Because, you know, for such a long time, transsexual people, much like homosexual people, were, you know, told that they were mentally ill for feeling the way they felt about themselves and their physical existences, their sexual existences. And it wasn't until, like, you know, advancements in plastic surgery and in endocrinology that have made it possible for people to choose to change their bodies instead of being subjected to, like, you know, really awful psychoanalysis to change who they are, like, who they are, you know? You change the shell rather than, like, the person you are, and, you know, forcing your spiritual self to conform with what other people want from you. Shit, I totally forgot where I was going with that. Oh yeah, so, like, a lot of times being trans kind of gets lumped into, it gets pathologized as a mental illness in and of itself. That's starting to go away in the psychological community, which is really awesome. But it's definitely still there. And something really big that because I said I have a borderline diagnosis, which is already a very stigmatized and misunderstood diagnosis in and of itself. And, you know, a lot of people won't treat borderlines because they're, like, annoying and incurable and all this, you know, awful, awful stuff that people in the psychological profession should not be saying about mentally ill people. But, yeah, one of the big hallmarks of borderline is an unstable sense of self as well as fleeting obsessions, which, you know, those two things have definitely made me question being trans a lot. It's something that pushed my coming out, and even my questioning back years and years and years was fearing that this is just another obsession. This is just another facet of me being crazy. This is just, this will go away. This is fleeting. But the thing is with borderline people, and this is like, if anybody who's shouldering a borderline diagnosis with transgenderism and feels insecure about their transness being a manifestation of borderline, let me just say that, like, the big thing that I keep in mind that helps me out is that for borderline people, it's all about instant gratification. And with transitioning, there's no instant gratification. Like, in the past, year and 2 years or whatever, and figuring out myself, it's taken so much, like, dogged and like, fearless introspection, not just, like, looking at what I want to look at and, like, go away. No, it's, like, looking, and, like, it's taken a lot of lucidity and self-discipline and, like, patience and, like, working with my body and learning my body and being in my body, and that's such a challenge for someone who's borderline, and even more of a challenge if you're borderline and trans. So, yeah, I mean, I guess this is like a really long-winded rant, per usual, but I just wanted to get out there, like, just more of the reality of what trans people confront when we are dealing with healthcare, and that it does transcend, like, the whole surgery idea. It's way more complicated than that. It's about everyone having equal access to healthcare that makes them feel comfortable, that makes them feel cared for, that makes them feel prioritized, that makes them feel like, they're being benefited and that their health is actually going to be taken care of. Yeah, I guess that's all from me for now. Once again, I am Brennan. You can follow me at GenderDen on Tumblr, as well as RxBrennan on WordPress. GenderDen's more of like a gender blog, obviously. RxBrennan's just my personal stuff. Yeah, so that's all from me for now, and I hope you all have a wonderful, wonderful Thursday, and take care of yourselves.